Here in a convention center in Detroit, Lieutenant Colonel Greg Turner is preparing for a new kind of war.
The Corps of Engineers has responded to disasters many times. Hurricane response, flooding, that's normal playbook stuff. What's unique about this is it's not in our playbook. We will build partitions.
But with 22 years of service to his country, Lieutenant Colonel Turner is no stranger to crisis.
This reminds me of my time spent in New Orleans, 2005, responding to Hurricane Katrina. This is different because it's nationwide and something that we're not used to, but we're ready for this.
1,000 miles away in New Orleans, Louisiana native Dr. Jim Aiken knows all too well the damage the hurricane wrought.
If Katrina was hell, what's COVID-19?
The gates of hell.
All across the country, it's places like these that are struggling to stave off this virus's attack. Louisiana, Texas, Florida, New York, Georgia, and Michigan. Tonight we take you inside some of these emerging hotspots and their fight to slow this outbreak.
So amazing. 2 days ago, this was a blank concrete floor. Now we're putting a 600 rooms into here with nursing stations.
In Detroit, Lieutenant Colonel Turner is tasked with the colossal order to transform downtown's TCF Convention Center into the largest alternative hospital in Michigan.
After the 9th of April, we should have 1,000 beds in here with staff working it.
Cases in Michigan have been steadily climbing, doubling every 3 days. The number is now well over 10,000 infected with more than 400 deaths.
Roughly 100,000 square feet, and we can build patient rooms into that.
As the city braces for a surge of new COVID-19 cases, Lieutenant Colonel Turner and his team also anticipating they'll build additional sites.
We are looking across the state. We've done assessments mostly in the southeast Michigan area, Macomb, Wayne, Oakland counties, but we're also looking west.
But right outside the city, it's not just hospital beds that worry Dr. Nick Gilpin, but staffing.
We certainly have the ability to do field hospitals in our community, but who's going to staff them? You know, I barely have enough nurses and physicians to make sure that we're taking care of the patients within our own walls. I certainly don't have the ability to lend any of my staff to another alternative care site for care.
At Beaumont Health, he and his team have been monitoring the spread and preparing for the worst.
We were watching the response that was happening in China, but I don't know that any level of preparedness would have been enough for this, frankly. I think it's fair to say that Detroit is getting crushed right now.
We are running out of ventilators, and I feel like we're playing musical chairs with the ventilators we have on right now.
I was talking with our bereavement office. They're flooded. They're trying to make sure they have enough body bags.
The whole of the city of Detroit is a medically underserved area. A lot of these patients are going to continue to require care, and we just don't have that infrastructure in place right now.
In Louisiana, cases have soared to nearly 10,000, a 42% jump overnight, with more than 30% of those patients hospitalized.
Trying to make sure everybody's signing this.
Majority of the patients we are caring for now are all COVID-19 patients who require isolation, and they're extremely sick.
Crystal Reisinger, the ER nursing director at Ochsner Health, just outside of New Orleans, is encountering a storm of patients.
We are seeing patients decompensate extremely quickly and placed on ventilators.
Already, the medical center's West Bank location has no open ICU beds. But there was some good news. My colleague Marcus Morris spoke to the doctors there. They said they'd gotten the 5-minute test, the only hospital system in the state. They hope these new tests will ease some of the burden of overwhelmed frontline teams.
I never thought that as an audiologist I'd be on the ICU floor. It's scary.
At LSU Health, Dr. Jim Aiken's specialty is wide-scale emergencies, from natural to man-made disasters.
In Katrina, you knew that backup would show up eventually. It may have gotten there late, but it got there. With COVID-19, there may not be backup for you.
No, and in fact, with Katrina, we had plans, and we felt like if we could just work this plan, that we would get through this. And for this pandemic, though, at the end of the day, you think, I can only hope that we've done enough.
It's a rare sort of bravery he and his team possess, cautious optimism, even in the face of a pandemic like this.
It's a nightmare in progress. You have the combination of a rapidly spreading pathogen virus and a highly virulent virus.
About an hour away in Baton Rouge, the Lady of the Lake Regional Medical Center has also begun seeing a growing wave of COVID-19 patients.
I'm pretty anxious to see how today is.
Nurse Morgan Babin began recording video diaries earlier this week.
Not 100% sure how things can get worse from here.
By this morning,
I didn't sleep too well.
Growing realization of the very real peril of her work on the front lines.
I think I just started reflecting back on my shift from yesterday. Several of us started to kind of smell an odor, which is natural, not speaking ill about the patient. And we kind of looked at each other like, do you smell that? Because if you're N95, whenever you get fitted for N95, they do a smell test and you shouldn't be able to smell things. It just made me realize what a big sacrifice myself and my coworkers are making.
In New York, the epicenter of America's crisis, the numbers are staggering. The death toll, more than 1,500. More than 650 people dying in just 24 hours. The Javits Convention Center now accepting COVID-19 patients to handle the overflow.
This is our ED. You can see all the rooms are filled. There's patients everywhere because of this.
In this video provided by Mount Sinai, Queens, Dr. Matthew Bai taking us inside his emergency room.
All these patients here sitting out in the hallways because we are full.
Earlier this week, ABC's Eva Pilgrim went to one of the New York boroughs that's been hardest hit, Queens, President Trump's hometown.
So what's it like right now?
Crazy. It's madness. There's no other way to put it.
All right, another ambulance just pulled out.
This woman says her aunt is COVID-19 positive and has pneumonia.
Who's going to help her?
She's scared.
I'm scared for her.
More than 20% of the EMS force is now out sick, but the city is getting some much-needed relief.
250 more ambulances are coming right away to New York City from FEMA, from all over the country.
It can't come quickly enough for John Rugen. It's been a week since he last saw his son.
Last night he asked me, he said, when you gonna come get me? And I told him when everybody stops become sick, or when they stop going to heaven.
But it isn't just big cities and their suburbs. Almost 200 miles outside of Atlanta, there's another simmering hotspot, a small hamlet in the southwest corner of Georgia, where the governor just instated a statewide shelter-in-place order.
It just shows you, you're not safe in rural America, small urban. This isn't just for the big cities. It's for all of the United States.
The Phoebe Putney Health System, which serves 3 counties in southwest Georgia, has reported at least 750 cases and at least 35 deaths. Carley Rice is a nurse here.
Yesterday, I had to FaceTime a family member so they could say goodbye to their mom, their aunt, their grandma. And it's so hard. You start thinking about your family if this was you and all that.
For Terica Parks, this was her reality. She was diagnosed in March and came close to death's door.
Whoever thought that talking, something as simple as talking, would be this difficult.
She went to the ER twice, doctors telling her that her organs were on the verge of shutdown.
I started looking through all the old pictures of me and my kids and my husband. I was crying because I felt like I was going to leave them behind, but I didn't feel any more fight in me.
But she pushed through, making it home to a 2-week isolation.
So this is where I have been since March 14th. Self-isolation at its finest, y'all. It has been miserable.
But on this day,
I am finally free again. I am out of quarantine.
Terica is reclaiming what COVID-19 stole.
I'm excited. I'm getting ready to hug my kids.
From rural America to our urban centers, this spread of COVID-19 is growing. Men and women putting their lives, and for some, their experience with disasters past, to use to this real and current danger.
Your courage reminds me of the words of Booker T. Washington, 1895. Plant your bucket where you stand. So you decided to plant your bucket in New Orleans.
It will always be in New Orleans, and it will always be with my colleagues, my residents, and the wonderful hospital that I work in.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.